Hello everyone. It's my first meeting as well, so thank you. I'm really happy to be here. Um, First meeting and straight in with presentation. So I'll just get straight in. So yeah, I was 32 when I was diagnosed with inattentive ADHD. That was 32 years of feeling not quite right, of having multiple metaphorical plates crash around me frequently. And it was becoming apparent in social media that triggered my diagnosis. The algorithm found me, and a light bulb went off. But prior to this, ADHD wasn't on my radar, it wasn't on my friends and family's radar, and it wasn't on my doctor's radar. I didn't know ADHD was an option for me. And unfortunately, this isn't an uncommon story. And it's because I and others had the stereotypical picture in my mind of what ADHD would look like. I was picturing the naughty schoolboy bouncing off the walls, unable to sit still. And in reality, ADHD is a lot more than that. So my name's Roxanne. I can't remember if I said that or not, but I am now. And I'm completing an MRes in gender studies with the University of Chester. After receiving my diagnosis, I leapt feet first into everything ADHD. And became so enraged about the lack of voices like mine within the ADHD research that I decided to change that, and within about a month applied for my course and sort of dived headfirst into it. My research is looking at gendered experiences of ADHD, and I'll touch that on. Obviously, I'm going to be touching on that a bit more. I'm not going to give an overview of ADHD and what it is, because I'm going to assume that people here have an understanding of ADHD and its traits. If I'm wrong, then somebody wave at the screen, although I can only see two people at the minute, and I can discuss it briefly if needed, or maybe ask me at the end and I can go back to that. Okay. So, a little bit about my research then. So I'm conducting qualitative research, focusing on hearing people's stories. At the minute, I've conducted 5 focus groups with a total of 20 people, female and non-binary people, who were diagnosed with ADHD in adulthood. I wanted to do focus groups because I thought it was a good opportunity for people to share their stories and voices collectively in a community of like-minded people, to glean an insight of ADHD that has only really been done a handful of times so far. And I thought people would benefit from being in a group as well. And I certainly found that from taking part in the focus groups. I'm a huge advocate for qualitative research. I love it. And I think it's really needed in this area. And I'll touch a little bit more on that as well a bit later. But qualitative research allows us to give a voice to people who haven't had a voice so far in the research, who haven't been represented, and to offer a real in-depth insight into what it's like to live with undiagnosed ADHD. And then in particular in the context of people's gender and the stereotypes and stigma that often come along with that. My recruitment criteria you can see on the slide as well, hopefully, so you can see the people that I was aiming to talk to. So I'll come back onto that and share some of my findings, but backpedaling just a little bit, I wanted to explain my reasoning, or the gap for the research that I wanted to conduct. So there is a vast amount of research into ADHD, but obviously this has predominantly been done on men and boys, and there's a significant gender gap in the literature. And obviously this filters through into points of awareness and diagnosis, such as medical professionals, teachers, wider society as well. Symptoms are being unintentionally ignored or misunderstood, probably misdiagnosed, and huge groups of people are missing out on a diagnosis. I think it says 1 in 20 people are thought to have ADHD, but obviously not that many people are diagnosed with ADHD. So there's a big gap. The vast amount of research is quantitative in nature, which I get because it's a medical condition. But as a result, I think we're missing out on important insights about ADHD, what it actually means to have ADHD, particularly in a body that has only recently been recognised as being able to have ADHD. It's also deficit focused, examining the negative impact of having certain traits on others, society, or themselves. I wrote a recent essay around parenting with ADHD, and it was so bleak and disheartening. I was consistently reading how lax, harsh, and ineffective the ADHD parent is, and how disadvantaged the child of an ADHD parent is. And oh my God, it was such hard reading. I know I'm not a bad parent, but reading it on repeat almost had me believing it. It was just so deficit focused. So I think this demonstrates the need for the research to refocus and for researchers to think a bit more carefully about the wider impact of the research that they're conducting on the community and whether the right questions are actually being asked within the research. And the quote, "nothing about us without us," really comes to mind for me when I'm thinking about this. And a lot of the research is not done by those with ADHD, so also tying into that. So the quote on screen, it's from Hinshaw's research review in 2021, and they've highlighted the things that I've just discussed, and it is even reflected in the NICE guidelines as well, which states that ADHD is under-recognised in girls, they are less likely to be referred for an assessment, more likely to have undiagnosed ADHD, and also more likely to receive an incorrect diagnosis of another mental health condition. So that was updated in 2018, and it's still accurate now in 2023. My ADHD was diagnosed as depression, postpartum depression, and anxiety, and none of the treatment ever really worked. And now I know why, because it was incorrect. So we are now seeing the impact of the gender bias in the research. So as we already know, it's going to be influencing diagnosers and people who refer to diagnosers' opinions. And then when you consider that in childhood, it's for every 6 boys that are diagnosed, 1 girl is diagnosed, but then in adulthood, this balances to so it's for every 1 man and 1 woman is diagnosed. So that clearly indicates that there's the same prevalence of ADHD, but diagnosis is just coming much later. And obviously right now we're having a huge catch up of women being diagnosed later in life in adulthood. So I've got some quotes coming up from people in my focus groups to illustrate this as well. I am only just starting to go through my data, so it is really just the tip of the iceberg. I'm in the data analysis stage currently, but I think that they illustrate the general themes that are emerging as well as the points I've discussed. So I hope everybody can read that, but I'll read it out as well just in case. So it says, like, it's funny how we talk about kind of the rowdy little boy stereotype, but realistically it's all the same behaviors. It's just that for some reason when you talk about it with girls you use different words. So it's like, you're still fidgeting, but because you're not like getting up and throwing chairs for some reason, it's not a problem. And like, you're still talking and you still got big outbursts of emotions, but just because it's tears and not yelling at the teacher doesn't mean it's not any more of an issue. I think it's really important as well when I'm doing the quotes from people that it's still got all those little idioms in, like the likes and the and all of that, because it's really amplifying that it is their voice. It's unfiltered, it's raw, it's genuine. So that's why it's written like that, because I just think it's more authentic that way, and I think it's a better way of getting the point across. So yeah, there's a clear misunderstanding of ADHD symptoms outside of the hyperactive trope. So as a result, it's simply less likely to be considered an option for anyone who presents differently, and that's regardless of gender. That's going to be impacting everybody across the gender spectrum. But thus far, it has had a disproportionate impact on women and gender non-conforming folk, because ADHD on them, hyperactive ADHD on them, doesn't look how hyperactivity has been recorded so far, or it's seen through a different lens of gender stereotypes or anything. For example, like emotional dysregulation has also been really downplayed historically, and that's now only coming out how prevalent that can be with ADHD for men and women. And then when we look at the masking of symptoms, so I've got 2 quotes here. Oh God, sorry. There we go. I can't actually read Oh, no, I can. Sorry. Yeah. So it says, I've got really big emotions and I do struggle to keep a lid on them. That is true, like whether it's joy or anger, happiness, sadness, it's just so intense all the time. You know, huge ups and huge downs. It's what my life feels like massive peaks and troughs and very little stability. And I think that women and little girls are characterized as sensitive and kind of drama prone. And, you know, oh, she's making a fuss over nothing, that kind of thing. Or, but for me, when you're growing up, if bad things happened, that felt like my world was ending and I felt my heart break day in, day out over the smallest things. And then another person said, my family and friends will say, like, I'm a bit of a risk taker and that sometimes I can make impulsive choices and, you know, decisions. And I think we are more willing to accept that in men, actually, unfortunately. I think that impulsivity, that risk taking, that presents as more bravado or confidence in men, whereas in women, it presents us as like erratic or unstable or doesn't know how to settle down. So there's clear gender expectations there on those people who've said that, which is resulting in them trying to act differently. So, and resulting in more masking of symptoms. So, trying to hide their negative traits. And the age old idea that women should present in a feminine way, such as being homemakers, organized, patient, hold the mental load, quiet. And a lot of ADHD symptoms obviously directly contradict those stereotypes. For example, hyperactivity, disorganization, impulsivity. And then because of the expectations on women, when they act in dissonance to those stereotypes, they're judged or seems to tend to be judged more harshly than men and maybe work harder to overcorrect and hide these symptoms. One of the reasons my ADHD went undiagnosed for so long is thanks to my high masking skills. And that only changed after I had a kid and I didn't have the mental capacity to mask it anymore. And then these quotes illustrate as well how ADHD has a lot of crossover symptoms with other disorders, and that women seem to have a higher rate of comorbidities. So an additional disorder diagnosed along with ADHD, which is, sorry, a comorbidity, like an additional disorder diagnosed along with ADHD, such as anxiety, depression, addiction, or eating disorders. So whether this is due to the higher rates of masking or living longer with undiagnosed ADHD, can be hypothesized, but it's not really known. And I have spoke to a lot of late diagnosed people with ADHD, and I've yet to speak to someone who wasn't diagnosed with something else first, which I think is quite telling. And although that's not like in a statistic or anything, yeah, like I say, I think it's quite telling. Why do I think it's important to talk more about the individual experiences of ADHD and hear a wider variety of voices? So I know that there's a lot of binary talk of gender in the presentation, and it is difficult to avoid, unfortunately, because a lot of the talk around ADHD is binary in research, with the idea that there's a certain set of symptoms for men and a certain set of symptoms for women. And obviously, also, I am talking from my own experience as a cisgender woman. But I believe that our experience of ADHD is shaped by a lot more than our bodies, and it is shaped by gender expectations, how society treats us, the stereotypes we grow up with and internalize, the roles our hormones play, and our social class. And as well as that, I'm not even touching on the impact our culture, heritage, race, and ethnicity has on our experiences. Unfortunately, one of the downfalls of my research is that 100% of the participants are white, so it lacks that intersectionality, which is a shame. And obviously there is a severe lack of representation for people of colour in this area, and we really need a lot more research into it. And it would be naive to assume people's culture isn't impacting on their experiences of ADHD. But I hope what I'm doing is at least the start of making some headway in the area, and everyone deserves the benefit a diagnosis can bring. And these, I've heard repeatedly, one of the consistent themes that I keep seeing is how important diagnosis is, and that's what these two quotes sort of illustrate here. And she said, what does this diagnosis mean to you? And I said, I've never been so happy to fit in a box and be labelled. I said, because for the first time in nearly 27 years, I make sense to myself. Like, I've got so much more to discover and wrap my head around and understand. But actually, the majority of me makes sense for the first time, my whole entire life. And I don't feel like I'm this alien from outer space that's broken. And then the other person says, so yeah, it's been close to 3 years. I'm still very much figuring stuff out. Oh my God, I still have no idea. I'm still working out what coping mechanisms work, what ones don't, which strategies are good and which ones aren't. Sometimes I feel like I've made no progress. Other days I feel like I'm a completely different person. It's a wonderful roller coaster, but at least I have a bit more knowledge now, and I'm so grateful for that forever. Um, and I'm really passionate as well about self-diagnosis being valid in the current circumstances, in the context of everything that's going on with waiting lists and everything. And it both self-diagnosis and diagnosis enables people to feel validated, for their self-esteem to improve. People are able to start unmasking and be authentic. And you see this within the online and face-to-face communities that are being set up for people with ADHD. Receiving my diagnosis was truly a turning point for me. And doesn't everyone deserve that, regardless of gender or other circumstances? And the more people we talk to, the more we understand, and the wider our understanding of diagnosis and the diagnostic criteria will be, and hopefully extend. I don't know if I'm racing through this or not, but I'm nearly finished actually. So before I finish, I just want to talk a little bit about autoethnography, because this is clearly an autoethnographic piece of work. I mentioned previously that a lot of the research isn't done by people with ADHD, and I'm so passionate that this changes. And I think this quote is really illustrates it beautifully, about embracing vulnerability with purpose, because that's sort of what I feel like I'm doing in a way. And I want to interweave and use my own experiences throughout to aid understanding, and also critically reflect on my own emotions and feelings and thoughts throughout as part of my analytical process. So after each focus group, I recorded little voice notes, because I found that I did feel emotional, upset, fired up and elated, and all sorts of different things. And I just wanted to have that recorded so I could be aware of them and come back to them, and also be aware that the impact that could have on my own experience and interpretation of the data. And hopefully maybe use it in my project in some way, although I've not got to that stage yet. I think having ADHD brings me a passion and drive for the research, as well as a deeper understanding of the participant group. Obviously, as well as people here probably be aware, also creates problems with deadlines and procrastination. Currently procrastinating very hard from my data analysis, but I'll get there. And then lastly, I just want to touch on this bit. So when I started my research, I was really conscious about being able to share my findings so they have the most impact and reach a wider group of people. So I set up this social media page for the purpose of sharing the findings and recruiting participants. I also use the space at the moment to share first-hand stories of those with ADHD that people have voluntarily messaged in, just to reduce stigma and increase awareness. My current procrastination from analysing my data, I did a mini podcast series, which is just a 10-part chat with other late diagnosed women with ADHD. So that's all there on that page if anybody would like to have a look. And ultimately it is all relevant. I want to hear and share people's stories. That is what my passion is, and that's what my driving force is. And by doing that, both on the social media page and academically, I just ultimately hope to reduce the misconceptions around ADHD and to start to understand the wider social change that can be enacted to start pushing the burden of living off the individual with ADHD. And this is just one of my favourite quotes from a focus group, and I think a perfect one to end on. And it's, we need to have this knowledge now. Like, we need more people to do these studies to make sure that kids can just grow up and not feel like bloody aliens. And then they can just, be supported so much sooner. And, they still have ADHD, but they'll not have all the mental health beep to go with it, And that's my references. And there we go. That's it. Thank you.